Hello and welcome back to the Breastfeeding with Confidence podcast. Today I am welcoming Nurse Sarah to talk about how gestational diabetes can impact breastfeeding. And this was actually pulled from an Instagram live. It is a replay. So I just wanted to let you know if the sound is a little different, that's why. Let's go ahead and get started. I'm Jamie Zaki, IBCLC and Mama 5, and this is the Breastfeeding with Confidence podcast, where pregnant and new mothers learn how to prepare for and overcome breastfeeding challenges without being controlled by stress, fear, and anxiety. Each week, we'll answer your questions, share breastfeeding success stories, and inspire you to shut out the toxic whispers of the world and embrace your God-given intuition to make confident breastfeeding decisions. Let's dive in.
Tell everybody just what you do and why you do it.
Okay, thank you again for having me, Jamie. My name is Sarah. I'm a labor and delivery nurse primarily. I started right off at a school doing labor and delivery. That's my first passion, my love, and I love helping women get educated. And now I'm more in the role of a high-risk OB nurse. So I am like helping all kinds of high-risk women, but primarily I realized that gestational diabetic mamas really lack support and the knowledge and really the resources to have a healthy pregnancy and have their dream birth and have a healthy baby. So as I'm working with these women every single day, I'm like, oh my gosh, like someone needs to help them. And I feel like I can do that because I help them every single day. And that's really my passion now, just helping women one mama at a time. But yeah, that's a little bit about me.
Yeah, I love that. But I'm going to ask you a few common questions
Yeah.
about gestational diabetes that we can go into. But I know for a lot of moms, it's like gestational diabetes can be really overwhelming because
Yeah.
it can feel you can feel like, very helpless. I think a lot of moms feel very helpless, and it can set you up into this mindset of like, in some, like, it's not necessarily preventable all the time, right? So it's
Yeah.
like, if it's not preventable, then I just have bad luck, and now I'm destined to have bad luck, and it's going to ruin my birth plan, and it's going to ruin breastfeeding. And I get that question all the time, like, can I
Yeah.
breastfeed if I have gestational diabetes? I'm like, absolutely. We might need to do a little work to make sure that happens and to support that, but absolutely.
And it's
So,
beneficial for both mom and baby.
exactly. So, what is maybe some of the biggest concerns with gestational diabetes that you see, and some of the biggest challenges moms with gestational diabetes face?
So, like you said, exactly that. The concerns are really like, oh, I'm never gonna have a healthy pregnancy. I have to go to the doctor a million times, and they tell the patients, oh, your baby might get too big. You're gonna get induced early. You're gonna have a C-section because the baby's too big. You can't have your dream birth. You might not be able to breastfeed, just like you said. Really, it's just derails their entire vision of what their pregnancy, like the moment you get your positive pregnancy test, like you're just so happy, and then all of a sudden you're just like, what do I do now? And the second part of your question is there's really a lack of support and education for GDM mamas. I work in a high risk pregnancy center and we do specialize in this, but still, like, there's so many patients. It's so common that, like, they literally, like, you have 30 minutes with a diabetic educator. And what, honestly, like, it's really so hurtful that they don't have more resources for these mamas. Like, how can you help someone in 30 minutes, really?
Yeah.
Especially as gestational diabetes can really change throughout your pregnancy. If it's not controlled, it affects your entire birth plan. It affects everything about you and your baby. That's really the issues that we're facing with these women. And then as a labor and delivery nurse, I saw the back end of it at first, and I was like, oh my God, like all GDM mamas need to give their babies formula. Like all babies that were born were like low sugar.
Yeah.
That's what I
So
thought.
let me ask you about that, because
Yeah.
blood sugar is definitely one of those things that people are like, oh yeah, you can totally breastfeed your baby if their blood sugar is fine, but if not, then you're gonna need formula. And I'm always like, that's not,
Yeah.
it's not that black and white.
Yeah.
We can prepare, first of all, during pregnancy by doing antenatal colostrum expression. You can store colostrum and have it ready to go to work on your baby's blood sugar right away. That way, you have that. Even if you can't do that, we have
Yeah.
options. So do you want to, well, first let's talk about the options of how we can manage blood sugar
Yeah.
in a newborn. and then we'll talk about, I have a couple other questions, and then I want to kind of circle
I
back
know
to how moms
it's
can.
like, it's like,
I know. There's so much to go
yeah,
over, and I know you have some resources for everybody, so I'm sure that you have a lot that you cover there too. So I just want to
yeah,
kind of do a little touch on everything and let them come to you to go deeper if they need to. But
I love that. Yeah,
so what are your preferred options for managing, or just let moms know, what are your options?
yeah,
What can they ask for in the hospital?
yeah,
What can they say, like, I don't want to do formula, like these are the steps we're going to take before we get there?
right. I love that question because I've seen it so many times in my shifts. So first of all, about the antenatal colostrum, I do support it only after full term. I know like it's like very, very popular now, but only because if you're preterm, it could cause preterm contractions, and we don't want any preterm
Yeah, so
deliveries.
actually,
Yeah.
the research around that is not actually that black and white. So moms who are
Well,
on pelvic rest and that are at
yeah.
like high risk, I know you're working with a lot of high risk moms.
Yeah. So for
So if
me,
you're,
it's like,
yeah, if
yeah,
you're on pelvic rest or you're high risk in
yeah,
the sense that you're at risk for preterm labor,
yeah.
it's something to be cautious with, and we recommend waiting till 36 weeks. But if you are cleared for sex, basically, you can do prenatal colostrum expression because the amount of oxytocin released during an orgasm is actually higher than hand expression.
Oh,
So,
okay. That's good to
yeah.
know. Okay.
Yeah, it's an interesting, like, people don't really put that together. And once you start talking
Yeah.
about it, it's like, oh, so
Yeah, well, I tell my patients all the time that induces labor naturally. Exactly what you said. Exactly. Yeah, but also about the hand expression, like you said, it is safe, but if you start contracting too much after you start, we recommend that you stop
yeah.
also only because it can cause fetal distress if you keep contracting and there's
Yeah,
no
definitely.
stop.
If you're like, I always tell moms, like, listen to your body.
Yeah,
Your body's going to tell you if it's safe or not. And so just listen to your body. Yeah.
100%, 100%.
Once the baby's born and they're
Yeah.
like, okay, you had gestational diabetes, we need to check their sugars, and we're probably going to have to use formula. And mom's like, but I don't want it. What do we do?
Okay. So I'm in New York. I don't know how it is around, everyone is different. We have different policies. Where I worked in two different organizations. We were baby friendly. So we kept the baby with the mom, both organizations. My first one, we didn't have the glucose gel, which kind of it really impacts blood sugar. My second organization, that hospital that I worked with, I really loved because we obviously we have to check baby sugar. So what we do is after baby's born and baby is stable and perfect and pink and crying, we always keep baby skin to skin because that's the first thing that helps promote normal sugars and also helps bonding and breastfeeding and oxytocin release for natural, to help prevent any hemorrhage, which is evidence based. Then we check their sugar after an hour, and we do help the mother latch within that hour as well to help stimulate the colostrum so that baby can get a little bit too.
And so I think
Let's
that's really important
Yeah,
for moms to know is like, you're getting
yeah.
that full hour. It's not like we're checking it right away and
No,
rushing you.
no, we're not supposed to check it, and we do the weight and the sugar after 1 hour. We
Okay.
let the baby stay on the mom as long as baby is stable and mom is stable. Yes, it's uninterrupted.
That's
Even
awesome.
vitals we do on the mother, of the baby, we do it on the mother, which is great. And then after we check the sugar, if the sugar is less than 45, in my organization, everyone is different, that's considered low. So we would give like a glucose gel in the cheek, and then we would help the mother feed the baby. We don't promote formula at all right away. We say, let's help you latch.
Mm-hmm.
So we help the mother breastfeed, and after baby is done eating, we recheck the sugar after 30 minutes. And if it's still low, obviously we're calling the provider. If it's still low, we give the baby glucose again, and we help the mother latch again. If the sugar is consecutively low, then there is an issue with that, and that'll escalate to NICU. But honestly, they really don't want to send the baby to NICU or give formula. And another part I forgot to mention is that if your sugars are stable throughout your pregnancy, you really shouldn't have an issue with the baby maintaining their blood sugar. So that's the key part before all of this. So that's why I help women throughout their pregnancy maintain healthy blood sugars. And so the baby is not too big either, because if the baby is too big plus GDM, that's like a recipe for like low sugar kind of
Right,
thing. But we
right.
can always support.
I think that's really important is it's important to know your
Yeah.
options and your plans for if baby's blood sugar is low.
Yeah.
But instead of being reactive, let's make a plan to be proactive and prevent this from being a problem
Exactly.
anyway. I love that. And I think more moms need to know that, because I think, like we said before, there's just a lot of fear around it, right? So
Yeah.
if you think that there's nothing you can do, like this is all that's going to happen, like if you're out there and you're listening and you have gestational diabetes, there are things you can do. So what are some of your top tips for moms that are like struggling to manage their blood sugar and really need help with that and support? What are 3 things that they can change as soon as they find out they have gestational
Yeah,
diabetes?
I love that question because I like to keep it very simple because let's face it, you can't really change your lifestyle just because, you found that out. Some people it's just like they can't. You have kids, you're busy, you're working. The first thing I would say is really meal plan. As a mom, you're gonna have to meal prep even later on. So this is teaching you how to have healthy habits for your postpartum, for your future. So
Mm-hmm.
meal plan your whole week or whatever it is. Make it simple and make it delicious that you want to eat it. If you want to have carbs, it's fine. Just don't make it the whole part of your plate. Limit the carbs to like a third and then have protein and pair the carb with the protein, whether it's an animal protein or a plant protein like eggs, chicken, fish. And then you want to pair it with a healthy fat as well, like nuts or avocado. And once you see like colors on your plate, you know that you're like having a balanced meal. And then another tip would be increase your water because water helps flush out the glucose faster. And also it's better for the pregnancy as far as amniotic fluid and all beautiful things like
And
that.
I think a
And
lot
then
of moms struggle with
yeah,
that. Like I know I struggle to stay hydrated
yeah,
as it is, and then if you've got an extra thing on top of it, plus a lot of people don't realize that gestational diabetes can affect your kidneys, and so if you're not hydrating
yeah.
enough, then you can have more negative
Kidneys,
impacts on your body
stones.
systems.
Yeah, 100%. It's so funny you mentioned that because as a pregnant mama, I never drink water, especially I was like running around in my shift. But once I was breastfeeding, that changed it because I was like, water is milk. I was keeping track. I was so good. But not when I was pregnant,
I know. I
unfortunately.
know. It's like hydration is a hard one. I don't know why it's so hard.
Yeah.
And what is your third tip?
Yeah, also for the hydration, if you have a hard time drinking water, I recommend that you put like things to make you want to drink it. If you like cold water, make it cold. I like putting mint or lemon in my
Oh,
water also to
so
flavor
good.
it.
Yeah.
Yeah, that's for my water. My third tip is really to stay active, especially after you eat. If you know, okay, I'm gonna eat this carb, whatever, you're not gonna tell your doctor, but you're gonna eat whatever, such and such. If you know you're gonna eat that, okay, so after you eat, just take a walk after you eat, and you'll see that your blood sugar will completely stabilize. And also, it'll help baby engage in the pelvis and it'll help you stay active and ready for labor. So, that's a really good tip. A lot of my patients tell me once I start walking after I eat, I notice a difference in my blood sugar. So, that's like a really practical tip that
That's
I tell.
awesome. I love that. What happens after your baby's born? Does gestational diabetes just go away? Do you still have to keep tracking your sugars? Are you at higher risk for type 2 diabetes? What's the next step in this, and why is it so important to make sure we're understanding that?
Okay, I love that question because as far as I've been a nurse, all I heard was, we're done with checking your sugars. You're good. And then you show up with your next baby and you have early diagnosis gestational diabetes. And what does that mean, right? So we have to start supporting mothers, especially after they deliver, because they need even more help, actually. Nobody is really supporting these mothers. So what does happen? So in reality, we do stop checking your sugars and they do say that your levels will normalize because it's mostly hormonal from the placenta. Once you deliver the placenta, your problems go away. But really, you're at a higher risk for developing diabetes later on in life. And the more times that you're pregnant and you have gestational diabetes, the more you're like likely to go from like we call it GDMA1 diet control, and then the next time you're pregnant, you could become medication control. So you might need insulin. And the next time you get pregnant, if you're not being in control throughout, meaning you're not watching your habits in between pregnancies, you can become a type 2, which we've been seeing. So it's really important that we're educating women and we're supporting them to help them, like, once you deliver, try to maintain your healthy lifestyle habits that you implemented during your pregnancy, and then take your 2-hour glucose test like 4 to 6 weeks, they say, postpartum, to see if you really did lose the
Right.
GDM, basically.
I've heard that a lot of moms, like, they're kind of realizing now that a lot of moms are being diagnosed with gestational diabetes, but really they were pre-diabetic before pregnancy
Yes.
and had no idea. So
Yes.
it just like ramped everything up. And so there's kind of sometimes it's a little hard to tell, like, are we finding actual diabetes, or are we finding just this is confined to pregnancy? So I think that follow-up is really important.
Yeah.
We're seeing so many women dealing with insulin resistance issues outside of pregnancy, and that does impact all of your hormones. It impacts fertility, it impacts breastfeeding. And so we're not really looking at that until pregnancy for most women, right? And so I think, it's interesting to see how things kind of evolve and everything. And interesting fact too is if you are breastfeeding, you are reducing both your and your baby's risk of type 2 diabetes. So if you know, just because you have gestational diabetes, it doesn't mean you can't breastfeed, and it actually is probably even more important that you do.
Yes, especially because formula can cause diabetes.
Yes, it increases the risk for your baby, and your risk is decreased if you breastfeed. So it's like, if we can work with God's design, like, it's all designed. When you start looking at all the pieces, it's all designed so perfectly to work together. And so we have to just kind of support that design and facilitate that.
Yeah, I love that.
I love how you mentioned exercise, because I think so many of us are, you know, between lifestyle things, like just having to work and raise children and being very isolated, it's hard to get that exercise in. And just what we're kind of, you know, taught during pregnancy is that, oh, you need to rest. Everything is too stressful for the baby. Don't do anything. And it's like, you have to stay active. Like, you really have to stay active. And it doesn't have to be, you know, you don't have to be doing a whole lot. You don't have to become some like crazy weightlifter or like super woman if that's not your jam. But you can be active. And you, like you said earlier, you know, like, learning these habits is so important all the way through motherhood. Right? Because you want to be healthy for your children. You want to teach your children to be healthy. We've got some of the highest obesity rates in children now. We have to teach them to be active and to eat healthy. And I tell moms that with breastfeeding too, is like, learning to advocate for yourself during pregnancy and breastfeeding is learning to advocate for your children when they're 15 years old and having some crazy health issue that everybody's brushing off. Like, we learn to, like, these stages of pregnancy are us learning how to be moms.
Yeah, 100%. I love that, because honestly, you're becoming a mother, and it's not just about, oh, you have gestational diabetes. How do you cope with all this? How do you cope with gestational diabetes? How do you cope with breastfeeding? It's so, you know, important that we're talking about this, actually. Like, everything you're saying, it's so true.
Yeah, and that's why I always tell people, it's so important to take a holistic approach to these things. And everybody thinks that means like super hippie or crunchy. And like, me personally, a little bit, but no, like, holistic really means taking a look at the whole picture.
Girl, you're a nurse.
The whole body, the whole spirit, and how it all works together. And the way our medical system is designed, right, is like one body system, one body system, and we're not looking at the connections between them. And when we start doing that and getting to those root causes, and then we can create plans and we can make decisions with confidence and power. I don't want to take up too much of your time, but what is like your number one tip to leave moms with? And then do you have a free resource that people can grab if they like are worried about gestational diabetes or want to learn more about gestational diabetes, be prepared if they have it?
What I would leave moms with is, you are not alone. This is so common, and we can help you have the best, healthiest pregnancy, your dream birth, and have a healthy baby. You don't have to suffer. You don't have to just go wing it and just like be thrown off the course. you can look back on your pregnancy and say, you know what, it was hard having gestational diabetes, but I did it.
Yeah.
I did it. I managed my sugars. I went into labor by myself. I didn't need to get induced. I didn't need to get sectioned. I didn't have a big baby. I was able to breastfeed. That's really, it really can happen. I've had so many moms that they had such a great experience, but it's not as many because it's just like a lack of support. So
I actually do have one more question
yeah,
for you that just popped up.
yeah, no
Because I was
problem.
just listening to what you were saying. I was thinking about my own experiences. I've had some big babies.
How big were
And
your babies?
you want to hear this? Okay, so my first was 8'4", my second was 9'4", my
Oh,
third and fourth were 10'4", and the fifth was 10'5". But I never had gestational diabetes.
vaginal?
Yeah.
Wow.
My first was a C-section.
Oh.
He was breached. My first was a C-section. The other four were VBAC.
So you TOLAC. Wow, you VBAC. Wow,
Yeah,
that's
yeah.
amazing.
But everybody's always like, you didn't have gestational diabetes, and I was like, no,
You just have big babies.
didn't. I just have big babies. But I have been wondering, like, I know that sometimes people will kind of when you have you get the glucose test done and everything. I know sometimes when people have blood sugar issues, what can happen is like when their blood sugar spikes, they actually like dump insulin, right? And so their blood sugar actually goes low. So is there a risk of actually having gestational diabetes, but it not showing in the screening because of that?
It does actually. It's a good question. Actually, it can happen.
Yeah.
And we find out when you come in for like a third trimester scan and you have poly, which is a lot of fluid, and we're like, or the baby's belly is big. When we do the growth, we look at the baby's belly and the baby's like head, and we measure the circumference of also the femur bone. So when we see that the baby's belly is big, that's showing us that the baby is getting too much sugar.
So it's not just a large baby, it's like certain areas being larger.
Yeah. So the belly, we call it the AC. If the AC is big, that means that the baby's getting too much sugar, or poly can be a sign. So we actually have people retest, believe it or not, like in the third trimester, and sometimes they do have gestational diabetes.
So do you ever see benefit to, because I know a lot of people who decline the test for gestational diabetes and they do like
paneling,
monitoring their blood sugar manually. Do you find that sometimes would catch that if they would test like a false negative? How do you feel about that option?
That's a great question. In my diabetes class that I took recently for pregnancy, somebody asked a question like that, and then the person teaching the class, she was also like a diabetic educator. She said that when you do that, you naturally eat like better, and the results can be skewed because you're like checking everything. So it might not be so accurate. You get what I mean? You're marking down all the sugars, so you're gonna be like, okay, you know what? I'm not gonna eat as much, or like I'm gonna walk after I eat. If you walk after you eat, your sugars are gonna be good. So it's kind of skewed.
That's interesting. But I wonder at the same time, like if it's controlled, it's controlled. Like controlled is controlled, right?
But most people, when they're checking themselves, they'll be good because they're like, okay, if I pass, I don't have GDM, and I don't have to deal with As
and I think that just goes back to then like just having really healthy habits as your baseline, like right? Because whether you test and your test comes back as a false negative, or you're like skewing, like there's so many different things that if we just have healthy habits from the start, like imagine if we were just raised on healthier habits. I know that doesn't necessarily prevent gestational diabetes, but it would probably help a lot of moms transition to those healthier habits easier.
I was gonna add to that, like actually I had a patient recently who had GDM in her first pregnancy, but then passed the second time around. So she ate whatever she wanted. She had a party with it. She came back for a growth in her third trimester, and the baby's belly was big. So the doctor told her, I know you, she's like, but I passed. And she was like, well, you might have passed, but because you had it in the past, you're more at risk, and you need to watch what you eat. Even though you passed, and even though like we're just me and you healthy, just walking around, we can't just eat whatever we want and not stay active. It will harm the baby eventually, like meaning like the baby can become too big, or you could have a lot of fluid because the sugar is not controlled. Remember, when you eat, the sugar is high and the baby keeps producing insulin. So when the baby's born and there's no high sugar, the baby's blood sugar drops.
Right.
And that's really why they have low sugar. So everything you do as a mother, we know whatever you eat, whatever, even if you listen to music, it affects the baby, right? So like you said, we have to have healthy habits.
Yeah. So what resources do you have for moms in supporting them and guiding them through this so that they can be making informed choices and feeling confident and not just being controlled by the fear around maybe having gestational diabetes or actually having it?
Yeah, so you can definitely look me up on Instagram, Gestational Diabetes Nurse. And I do have a membership where it's very like focused in, and we do weekly Zooms and we talk like more about recipes. I do have a nutritionist that's going to be starting to work with me. So hopefully we can really hone in on any of your issues with eating as far as that. And I do provide childbirth classes to help prepare mamas, and also breastfeeding support and postpartum support. So you could definitely reach out and join the membership, and have anything that you might need help with, we can offer for you.
Do you have any free resources that moms can come grab when they visit your Instagram?
Yeah, I have a hospital packing list, and I have a few other resources like common GDM myths.
That's so great, because I think it's always good to kind of, just get those basics down. Like if we can learn what the myths are, then we know what we need to start learning, and we know how important it is to get support from somebody who sees this every day and works with these moms and knows what challenges might come up in the future so that you can be prepared for them instead of being blindsided.
Yeah.
Thank you so much for joining me. I really appreciate
this. Thank you so much, Jamie. I really appreciate it too.
It was great to chat, and I love hearing just, all the different experiences that you've seen and how it's not one size fits all. And I think that's important for anybody to know, is none of it's one size fits all.
No, every mom's journey is different, and every baby that you have is different.
Yeah.
So
that is a fact.
Exactly. So if you had a horrible experience, let's say in your first pregnancy, and you have diabetes again, we can totally rewrite your whole story.
Yeah, I love that. So if you are listening and you have gestational diabetes and you are worried about it, you're worried about it impacting breastfeeding, you need to first meet with Sarah and learn how you can just prevent that in the first place, learn how to get those sugars under control and prevent the postpartum issues, and then work with me and we can figure out how to manage those postpartum issues if they do come up so that you have a plan.
Yes.
So thanks again for joining me. So I will chat with you soon.
Thank you, Jamie. So we should do a part 2 sometime.
Yes, we absolutely should. Because there's so much more to talk about. Like,
we could talk about it for hours.
I know.
All right, Mama Bear, that is a wrap for today. If this episode helped you feel a little more confident or a little more prepared for breastfeeding, can I ask you a quick favor? Go ahead and leave me a review. It helps other moms find this podcast and join us in this amazing community of fierce and confident Mama Bears. And hey, if you know a friend who could use some encouragement or real talk about pregnancy, breastfeeding, and all things motherhood, share this episode with her. You've got this, Mama Bear. Trust your instincts, stay fierce, and I'll catch you in the next episode.